So for her, nursing is an art, and it's about helping people and using technology to the best level possible to help our patients. So she's a bit different, that she actually identified technology, even in the early 70s, as something important to helping our patients, which is kind of amazing, actually. Because if you think about technology in the early 70s, it's a lot different than the technology we have today, right? So she says that nursing then is actions deliberately performed by nurses to help people change their conditions, change their environment, and help them meet that self-care deficit. So nursing is helping people identify problems or these deficits. I keep using the word deficits because that's the word she uses, but like the negatives in their life, and teaching people how to deal with them and cope with them so they can move past them and be healthy. So it needs to encompass, nursing needs to encompass both the patient's perspective, the physician's perspective, and the nursing perspective. So she said we need to work together to deal with the problems that patients are having in their life. We need to look at the patient's own ideas about their health, what we believe as nurses would improve their health, and what the medical diagnoses and the medical treatment is for this patient's disease. So if we're thinking about cancer, for example, the patient might have strong beliefs about cancer and what that means for them. Maybe they feel they're being punished. Maybe they feel like cancer is a death sentence. Lots of people believe when you get cancer that you're going to die. People have a very strong fear when they're diagnosed with cancer that it means that they're going to die, right, really soon. But from a medical perspective, with patients who maybe have stage 1 cancer, well, the physician would be very hopeful, right? They would say, we're going to do some surgery, we're going to do a round of chemo, a couple rounds of chemo, or a round of radiation, and we fully expect you to make a full recovery, right? And then from a nursing perspective, we would look at cancer diagnosis a bit differently. We would maybe look at, the grief that a person might be experiencing and the upset feelings a patient might be having about their diagnosis. We might consider the infection control practices necessary for a patient undergoing chemotherapy. We might think about, the medications or about the treatments needed. We might think about the painful procedures. They might have to get a PICC line or a port or something like that. So you might think about it from that perspective. So we each have our different roles and ways to think about illness. And Orem says we need to think about all of these things together to come up with solutions for our patients' health, to deal with their deficit in health. So really the goal of nursing, though, should be that nurses are not needed, really, is what Orem's saying. So she said that, yes, there are these very specific things that nursing does, but we should actually be training patients and their families to deal with the bulk of patient issues that patients are having. So if you have the flu, you shouldn't need to come to the hospital to get care from a nurse or a physician. You should be able to take care of that at home. And if you are coming to the doctor for the flu and seeing a nurse for the flu, then we need to teach you about how to deal with your flu at home. So next time you can deal with your self-care deficit of having the flu on your own, right? Doesn't mean that she says you never have to access healthcare services. She's just saying that families and patients need to be responsible for themselves. And they need to know how to do that. And we need to empower our patients and teach them so that they can be responsible for their own health. So they have the understanding and they're not so dependent on us to come. Patients shouldn't be coming back to the hospital to get their blood sugar checked. They should be doing it at home. And so this is the idea of Orem, is teaching patients to do these things. So we want to teach our patients and help them get to as near normal state of health as possible. We want them to live their life as normal as possible, even though they're having disease, injury, or illness.